Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a Machina edition. This audio podcast is part of a Quantix broadcast, and this audio podcast as part of a robotics biome, and this audio podcast as part of a Storm Robotics production. In this audio podcast, uh, I look at a research poster presentation in from 2015, where this research the research poster presentation was formally presented within the remit of the IBMS Biomedical Science Congress in 2015. The theme of this research poster presentation was in and around in line with nephrology and immunology. The 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 poster presentation was in on nephrotoxic looking at nephrotoxic nephritis, or NTN, and glomerulonephritis, and GN, and animal model looking at animal model versus human disease. And where this works is where this research poster presentation was a review, a sort of a review. In as part of this works there was a peer reviewed publication that sort of followed. And as part of the audio podcast with Storm Robotics, there is an audio podcast that goes through the publication, goes through the sort of peer reviewed and published publication. However, as part of this series, and this edition, as part of this Machina edition, I sort of look at this works in line to in sort of synchronicity with the IBMS Biomedical sort of Congress or Science Congress from 2015. So a bit of introduction. The terminology glomerulonephritis sort of encompasses a varied immune mediated disorders, that cause inflammation within the glomeruli. Thus, the functional components of are the functional components of and within and part of the nephrons of the kidneys, and other compartments of renal path of renal pathophysiology. The mechanisms of interaction between these cells and mediators of their sort of coordinated response to inflammation have been investigated and sort of elucidated in amongst sort of published works, in amongst published works. And despite the sort of pathophysiological advances, treatments for glomerulonephritis have remained sort of non-specific, sort of hazardous, and only partly successful. GN or glomerulonephritis therefore remains sort of a common cause of varying forms of renal disease or renal insufficiency, including chronic kidney disease or CKD globally. So now, animal model approaches offer some effective and safer treatments, sort of in treatments sort of in sort of prospectively, evidence immun- of immunological components such as complement deposition within glomeruli is a main feature of many forms of glomerulonephritis, and the role of complement is implied by several observations in human disease. Indirect evidence obtained from human investigations has been supported by findings in animal models. The mechanisms by which macrophages, so macrophages being hematological components, mediate renal injury remains to be confirmed, but it is likely to include promotion of inflammation through release of pro-inflammatory cytokines such as a tubular necrosis factor, recruitment of macrophages and other leukocytes through release of chemotactic molecules such as monocyte chemotactic protein 1 or MCP1, cell proliferation by release of growth factors such as macrophage colony stimulating factor or MCSF, and cell death through the release of release of reactive oxygen species. Now the aims and objectives of this works or this research poster presentation from 2015 was where research within animal models have informed the crucial sort of interactions between inflammatory cells and cells intrinsic to renal or kidney renal pathophysiology that is both fundamental and unique to the pathogenesis of glomerulonephritis. The objective of this works was to provide insight on a suitable laboratory sort of basis, i.e. nephrotoxic nephritis or NTN and GN in line with glomerulonephritis, and relate its experimental validity in humans. So the in around the epidemiology, in around the epidemiology or some of the epidemiology. So many cases of GN or glomerulonephritis result in sort of mild asymptomatic illness that is not recognized by recipients and remains undiagnosed. The incidence and prevalence of such mild episodes of glomerulonephritis or GN are unknown but could be substantial. In the United Kingdom, for example, the most common recorded renal diagnoses is glomerulonephritis or GN, and through evidence of biopsy proven and not biopsy proven in around 19% of cases, and followed by uncertain in around 18% of cases, at least again in line with in line through the literature, in around sort of in around before in around before 2000 in around before sort of 2015. At the same time, for all ages, the prevalence rate in men in male exceeds that in females, peaking in age groups between 75 to 79 years at around 2000 and around just over 2,900 per million population in males, and for females the peak is in age group age group between 65 and 69 years in at at just over 14 just under just over 1400 just over 1400 per million population. Population-based screening or screening investigations have informed and shown that evidence of renal damage by proteinuria, hematuria, low calculated glomerular filtration rate or GFR, or a combination of these features is present in around 16% of adults, and where investigators had and identified had identified had identified a particular particular and specific data in amongst an Australian population, in amongst an adult Australian population, and a similar proportion in the United States. In the United States, accurate classification requires a histological diagnosis. Consequently, the reported prevalence might vary according to local indications for renal biopsy. An investigation of all renal biopsies done in for example the Australian state of Victoria in one investigation during 1995 and 1997 had informed that 21 and that just over 21 people just over 21 people per 100,000 population per year underwent renal biopsy yielding a yearly incident of biopsy proven glomerular nephritis of 12.3 12.3 per 100,000. The most commonly diagnosed types or forms of glomerular nephritis in amongst the adult population were IgA nephropathy, focal and segmental glomerular sclerosis, and vasculitis. Those most commonly diagnosed in children or in children and pediatrics have been referred to as minimal change disease, focal and segmental glomerular sclerosis, and lupus nephritis, and IgA nephropathy, according to literature in around works by Briganti and team from around 2001. So in more now looking at looking at sort of the more specifics. So more specifics are in regard to the pathogenesis. So the pathogenesis of glomerular nephritis is complex. Intricacy arises from several factors, such as autoimmunity, cancer, and structural abnormalities within renal pathophysiology. There is variability in susceptibility to glomerular nephritis or GN, which is probable to have a genetic basis. There are also complex interactions between soluble factors, and for example, including antibodies, complement, chemokines, cytokines, and growth factors, and cells, both leukocytes and intrinsic renal cells that mediate glomerular inflammation. The contribution of non-specific factors such as arterial abnormalities in around arterial blood pressure or ABP and proteinuria promote continual renal damage despite resolution of initial insult. A constant feature of GN is the presence of inflammatory leukocytes within both glomerular and the interstitial compartments of the kidney. Macrophages and T lymphocytes are specifically are the dominant cell types present, and intensity intensity of cellular accumulation, particularly within the interstitium rather than the glomerulus, has repeatedly been found to correlate with clinical and pathological severity of disease in animal models and in human beings. Within the kidney or pathophysiology, renal pathophysiology, T cells and macrophages undergo activation, which is triggered by interactions between leukocytes and intrinsic renal cells, by interactions between cells, between cells, matrix and by cells matrix, and by cytokines and other soluble factors present within the inflammatory environment. Type 3 hypersensitivity also occurs when antigens and antibodies are present in roughly equal amounts, causing extensive cross-linking. It is characterized by soluble antigens and that are bound to cell surfaces in the case of type 2 hypersensitivity, and when antigens and antibodies sorry when these antigens and antibodies bind, large immune complexes large immunological complexes or components form that cannot be that have not been that have not been clearly depicted in amongst the literature. The reaction can take hours, days, or even weeks to develop. Type 3 hypersensitivity also represents the sort of more the sort of more progressive forms of glomerulonephritis. Now, in regard to sort of animal models. So an animal model is used or utilized during sort of as during sort of laboratory or research investigations in around particular and specific human diseases. The animals selected would usually meet a determined taxonomic equivalency to humans, so as to react to disease or its treatment in a way that resembles human physiology as needed. Research related regarding to nephrotoxic nephritis and glomerulonephritis can be traced back or tracked back to the 1960s and the 1970s, when investigations reported observations of the role of complement in nephrotoxic nephritis produced in rat models by either or through either rabbit or duck nephrotoxic sera or NTS, in contrast to commonly used animal models of immune complex mediated nephrotoxic nephritis and glomerulonephritis. The BALB C murine or mice models have been highly reproducible and require require short-term injections of lipopolysaccharide. The BLB-C nephrotoxic nephritis murine or mice model still holds experimental validity in the study of glomerulonephritis in amongst humans. In addition, the BALB-C model can be helpful in the investigation of the glomerulonephritis or autoimmune phenomena. Duplicating features of human glomerulonephritis have provided insights into the pathogenesis, and the reproducibility and uniformity of such animal models has also permitted a sort of step-by-step dissection of many of the mechanistics or mechanisms involved, and of the many mechanisms involved, and that literature goes back as far as the late 1960s. Works by Ridson and team in 1968, and works by Hook and team in 1987. Um, the research poster presentation goes also highlights some information in regard to in regard to the role of chemokines. Now, chemokines generally, or chemokines or cytokines have primarily been amongst research that focus in amongst literature that links to acute allograft rejection amongst transplanted recipients, amongst transplanted recipients primarily. However, in amongst some works there has been some literature that evidences the role of chemokines and cytokines in regard to glomerulonephritis, and in line to glomerulonephritis, and where this works looks at nephrotoxic nephritis as part of the role of chemokines. So it is now appreciated that when glomeruli are damaged by inflammation, growth factors are filtered into the urine, where they activate renal tubular cells, thereby causing them to secrete chemokines and cytokines. Intriguingly, one team had generated a specific chemokine being CXCR3 deficient, deficient murine or mice models to investigate the functional role of CXCR3 in renal in renal in sorry in the renal and within renal within the within renal system, or renal within the renal system under pathological conditions. Nephrotoxic nephritis was induced to analyze the molecular mechanistics or mechanisms of T cell recruitment in glomerulonephritis by CXCR3 and its three ligands. Number one, IP10, where IP10 has has a has a it has an affinity to CXCL10, MIG or MIG, which that had an affinity to CXCL9, and ITAC, which has an affinity to CXCL11, and to identify potential novel targets for therapeutic interventions. The research identified that chemokine receptor CXCR3 mediates renal T cell recruitment and subsequent tissue injury in nephrotoxic nephritis. The investigation provided a rationale for considering CXCR3 blockade in T helper type T helper 1 type mediated renal inflammation as prospective therapeutic options for patients with glomerulonephritis and glomerulonephritis subsets. And literature from or works from Panzer Panzer and team from 2007 had highlighted some of the more intricate aspects of the role of chemokines and the role of chemokines with with nephrotoxic nephritis and glomerulonephritis. Now looking at sort of looking at some looking at as part of this research poster presentation, some aspects of pharmacotherapy. So regular clinical follow-up, arterial blood pressure sort of control, and the use of angiotensin converting enzyme inhibitor, or ACI in recipients with, for example, protein urea exceeding 1 gram daily, 1 gram daily is advantageous. Findings have informed that more complete blockade of the renin-angiotensin system by the use of ACIs and angiotensin receptor antagonists is or has been superior to either pharmacotherapies alone for prevention of progressive CKD or chronic kidney disease amongst recipients with protein urea. Um, treatment of treatment At the same time, treatment of a particular specific symptomologies has slowed progression of experimental investigations of glomerulonephritis, but available trial data, but available trial data have been insufficient and to be recommended specifically for renal or renal for renal protection. Current pharmacotherapy linked with particular immunosuppressive therapies for human glomerulonephritis are not always uniformly effective, and are frequently associated with serious side effects. Corticosteroids are effective in several types of glomerulonephritis, owing to the ability to inhibit the pro-inflammatory effects of cytokines known to promote glomerular inflammation, including interleukin 1 beta or IL-1 beta, and anti-NF alpha, or tubular necrosis factor alpha. Now, some conclusions as part of this research poster presentation from this research poster presentation. The objective of the works was to provide sort of an insight on suitable model nephrotoxic nephritis and glomerulonephritis, and relate its experimental validity in humans. Animal with experimental nephrotoxic nephritis and glomerulonephritis are homogeneous, whereas patients or recipients and human glomerulonephritis are heterogeneous. Experimental disease is initiated at a time determined or identified by investigators, and run a predictable course. Predictable course, thereby permitting intervention at defined stages, including and before induction and during disease establishment, or late in the course, or late within the course. Patient typically, or recipients typically, has have sort of have forms of GN, have forms of glomerulonephritis before treatment can be given. So renal damage tends to be progressive in the longer term, despite elimination of the original source of injury. Hence why listeners, there are amongst the population, for example, where there is more susceptibility more susceptibility more susceptibility in regard to AKI, or acute kidney injury. Kidney injury primarily when evidenced, AKI, acute kidney injury, will would primarily affect and be linked to at least one form of glomerulonephritis, or GN. So differences between experimental and human glomerulonephritis or GN complicate a translation of experimental therapies into practice. Stem cell based therapies, in amongst literature has informed have informed that that that's that where investigators have informed that stem cell based therapies can be excuse me can be used, and these could include genetic modification to produce protective molecules within renal pathophysiology, or to promote regeneration of excuse me regeneration of damaged intrinsic renal cells. There is sort of a requirement of more up to date sort of evidence in around this works, and further work, prospective works or further works is required to translate animal model research to better comprehend GN or glomerulonephritis disease in humans. The complexity of GN research makes findings a challenge to replicate more consistently. And finally, there must be a sort of a continuing evidence-based assessment of immune and non-immune therapies to direct rational care for patients. That draws this audio podcast to a close. The audio podcast on social media will include or have the sort of some of the citations and references that are as part of this works. The full publication was published and referred to as nephrotoxic nephritis and glomerulonephritis animal model versus human disease, and the reference will be on social media as part of this audio podcast as a basis too. This has been an audio podcast as part of a Machina edition, an audio podcast as part of a Quantix, an audio podcast as part of a Lobostics Biome, an audio podcast as part of a Storm Lobostics production.